Welcome to SKK classes again. Today I'm going to talk about one of the most common topic which always must be there in every hospital with some patients, that is DVT. Okay, so now what is DVT? So DVT always refers to deep vein thrombosis. This is a type of disease in which a blood gets clotted or blood clots get formed in the deep veins of your body. I in my previous video I already told you about blood and how the blood gets circulated in the body with the veins, with arteries, or with capillaries. Okay, so I already told you in that video that arteries always carry oxygenated blood, veins always carry deoxygenated, and capillaries, they are having a connection with the vein and artery both. Okay, so now actually what is deep vein thrombosis? Deep vein thrombosis is that when a blood clot is formed in the deep veins which are lying in your body, then the circulation to some part that get affected. Okay, and then clot is formed. And why it happens? Because if the part, it can be leg, it can be arm, not getting enough circulation of the blood, so a clot will be formed. For example, if I can give you one very good example. Suppose sometimes what happen, due to rain, water get collected anywhere. Okay, and what happen after 2 or 3 days, some germs that will get germinated in that water, right? So in the same way, if your body circulation or your blood circulation is not proper, so there will be a problem. That I already clear you that veins, these are the blood vessels which always carry deoxygenated blood. Means from veins, the deoxygenated blood that will goes to heart and then to lungs for purification. But if the proper circulation of blood is not there, is not there, so what will happen? The clot will be formed, and that clot will create a lot of problem, and that sometime it gonna logged or the stuck with the heart, or can also get stuck in the lungs also, and can leads to very serious condition. So deep vein thrombosis always require, you can say, medical diagnosis, as well as some lab tests that must be performed and by the doctors in the hospital if the condition is very much serious. And apart from this, the medium, if the if I will say, if the disease is not too much severe, or it is in the starting stage, it can be resolved within months. But if the DVT is in a critical condition, okay, so it will take lot of time to recover, and it mostly happens not alone, but with some underlying disease condition. Okay, but if it occurs only alone, then it can be resolved easily. But if it's occurring with some particular disease, then it can be very much difficult to resolve this. But there are various types of tests are there, various types of medical management and nursing management is there. Now let's talk about some sign symptoms. Means if the patient is having a DVT, so how you can judge, how you can know that this person is having a DVT. Sometimes the person who is having a DVT, he or she always having a pain where? In the legs, in the calf. Okay, and there is some red or darkened skin is also there, and the veins on that area that will get swollen up. Means swollen veins will be present there, and dark area or reddish area that will be there. And if whenever you feel that area, or whenever you're gonna touch that area, the person always feel pain. Okay, So here I'm going to display one picture from that. From there you can easily gonna clear that what are the main symptoms of the deep vein thrombosis. Now see in this picture that these are the signs symptoms of DVT. That swelling of the leg or the calf muscle will be there. Then pain that may worsen when standing or walking, and warmth and redness of the leg is there. So these are the like main symptoms. How you can judge or you can just know that it can be DVT, but you can't say that from signs symptoms it should be clear. It needs some lab testing, okay? And that lab test. So now the question arises that what are the main things that should be done so that we can prevent DVT. Okay, so what are the main points that should be? First of all, you have to eat like a healthy diet so that a healthy weight that should be maintained. Then regular walking, okay, regular walking, and to improve the blood circulation of your body, that should be done. And apart from this, plenty of fluids, and you have to drink like lot of water and fluids. Then you have to avoid crossing of legs, okay, because whenever we are going to we cross our legs, so the blood circulation that get disturbed. So you have to avoid the crossing of legs. And for like some people always take the alcohol, so alcohol that should also be avoided. And like lab, if I'm talking about the lab testing, so lab testing, there are various lab tests that should be prescribed by doctors are there, like D-dimer test is there, then duplex ultrasonography is there, okay. D-dimer is just like a type of protein which gonna increased when if the patient is having a DVT, but doctors always prescribe this test whenever he or she suspect that it can be DVT. So just to confirm that, they will go through the D-dimer test, then duplex ultrasonography. If the D-dimer level that is increased, so they will go for duplex ultrasonography. So just to confirm that to what extent DVT is there, so that the doctor can do medical management according to that thing. So now I'm going to talk about the nursing management, which is the main part as in our that what we can do to prevent the patient. Suppose if like I already told you about that you have to do walking, you have to do exercise to improve the blood circulation. But if the patient is very much critical condition, suppose if like a patient is having already very much underlying disease conditions, like he or she is on ventilator, then what are the main things that you have to do as a nurse so that DVT can be prevented in those patients also? So what is the main nursing management that as a nurse you have to do? First of all, you have to provide comfort to the patient. Then how you will provide comfort to the patient? You have to elevate the affected area, means which part is suspected to be DVT. You have to elevate that area so that the blood circulation of that area that should be improved. And if the patient is having on bed, so you have to encourage early mobilization and leg exercise so that to improve the blood circulation. As nowadays DVT pump are there, in which the legs of the patient that should be wrapped, and their circulation through this DVT pump that can be improved. And you have to like give the proper position to the patient, and always ask the patient to put pillow between their knees, so that the circulation to that affected part is improved. So this is all about the DVT and its medical management and nursing management. So, and whatever you have to things you have to done to prevent DVT, that I already told you. Okay, thank you for watching SKK classes.